Step 1, remove all rings and your wrist watch. Step 2, stand close to the sink without touching it. Step 3, turn on the faucet and adjust the temperature of the water to warm. Step 4, wet your hands and wrists, apply liquid soap, and work into a lather by rubbing your palms together and rubbing the soap between your fingers at least 10 times. Step 5, scrub the palm of one hand with the fingertips of the other hand to work the soap under the nails of the hand, then reverse the procedure and scrub the other hand. Also scrub each wrist. Step 6. Rinse hands and wrists, holding hands lower than elbows to not touch the inside of the sink. Step 8. Reapply liquid soap and rewash hands and wrists. Step 9. You're going to rinse hands thoroughly again while holding hands lower than wrists and elbows. Step 10. Gently dry hands with a paper towel. Use a dry paper towel to turn off the faucet and discard the paper towel. Call the patient in and greet the patient. Go over the patient's information.
Elizabeth?
Yes.
Right this way. My name is Richard. I'm going to be your medical assistant today. We're going to take your height and your weight. If you want to go ahead and take your shoes off and put down your purse and then step up onto the scale, please. And then what we're going to do is we're going to zero out the scale and make sure everything's to the left. We're going to move the bottom one to approximately 100, and then we're going to move this top one, scooch it over until it's right in the middle. You are 124. Let me write that down real quick.
Yay.
And then we're going to have you turn around. Then I'm going to take your height. With the measuring bar perpendicular to the ruler, slowly lower it until it touches the patient's head. Got high hair, so I'm gonna push it down a little bit. Okay, and then you are 60 inches. I'm gonna put that down for a moment, and then I'm gonna help you off of the scale. There you go. And if you wanna go ahead and put your shoes back on, and we'll take you down to the examination room.
Step 1. Position the patient with the arm to be exposed, supported by the forearm on the lap or a table and slightly flexed. With the palm upward, the upper arm should be level with the patient's heart. Step 2, expose the patient's arm. Step 3, palpate the brachial pulse in the antecubital area and center the deflated cuff directly over the brachial artery. The lower edge of the cuff should be about 1 to 2 inches above the antecubital area. Wrap the cuff smoothly and snugly around the patient's arm and secure it with a Velcro edges. Step 5. With air pump in your dominant hand and the valve between your thumb and forefinger, turn the screw clockwise to tighten. Do not over-tighten. While palpating the brachial pulse with your non-dominant hand, inflate the cuff and note the point or number on the dial at which you no longer feel the brachial pulse. Step 6. Deflate the cuff by turning the valve counterclockwise. Wait 30 seconds before reflating the cuff. Place the stethoscope in your ears. Place the diaphragm of the stethoscope over the brachial artery and hold in place with non-dominant hand. Step 9, you're going to inflate the cuff at approximately 30 mm Hg above the number felt during Step 5. Step 10, you're going to release the air at a rate of 2 to 4 mm Hg per sound. Step 11, listening carefully, note the point or number on the gauge that you hear the first clear tapping sound. This is the systolic sound. Step 12, you're going to continue to deflate the cuff when you hear the last sound. Note the reading on the gauge and then quickly release the cuff. Step 13, remove the cuff and press down any remaining air. And step 14, record the measurement.
All right, 111/77.
Woohoo!
We're going to take a temporal temperature with a thermometer against the forehead. You're going to depress the on-off button. This is this big guy right here. Depress or press. Boom. Move the thermometer across and down the forehead, down onto the temporal spot, and then release the button over the temporal artery. And you're going to wait for the thermometer to beep when it senses no signs of temperature rising, 98.7. After the beep, remove the probe and note the reading on the display screen. Alright, next I'm going to go ahead and take your pulse. I'm going to hold my fingers right here on the artery, and I'm going to count for a whole minute. In actuality, I'm only going to count for 30 seconds. I'm going to note it in my head at 30 seconds, and then I'm going to stand to the side and I'm going to watch the breathing pattern of my patient. Note, you don't want to tell your patient that you're watching their chest rise and fall because they're going to start breathing all funky. So I'm going to act like it, but really my eyes are not where they think they are. And then I'm going to take both measurements and I'm going to put them down in the chart. All right, Elizabeth, now that we've taken all your vitals and your statistics, we're going to go over your chief complaint. What brings you to the office today?
My wrist.
Your wrist. And where's the pain now?
Right here.
And how did it start?
It just started. I think it's an old injury, but it just hurts.
How has it been hurting this time?
Anytime I put pressure, like when I'm pushing the car seat button or twisting something, it's a sharp pain.
So when did you see it start?
I started seeing it start probably in the last week.
All right. Is there anything else happening? Any other symptoms besides? No? Anything that you do, does it make it better or worse?
I'm not using my hand.
All right. And then have you taken anything over the counter, non-prescription medication?
No.
All right. Do you have any allergies to anything?
No allergies.
No allergies. Thank you. And the doctor will be here momentarily.